Greetings, and thank you for attending this virtual presentation of ISEMID, a new diuretic available for treatment of heart failure in dogs with myxomatous mitral valve disease. I am pleased to present this information on behalf of CIBA and to provide my perspective on the efficacy and safety of ISEMID for this indication. The availability of ISEMID offers, for the first time, a choice of loop diuretic agents when treating congestive heart failure. I hope you will find the following information helpful and intriguing. For those attending the webinar on November 13, 2020, I will be available live for questions following the conclusion of this presentation. These are my disclosures. Over the next 45 minutes, I will first offer a brief review of heart failure and ISEMID's relevant clinical pharmacokinetic and dynamic properties, and compare the potency of ISEMID with furosemide. We will then spend the remainder of our time examining the results of the Carpodiem clinical trial and how these results led to approval of ISEMID for treatment of first-time heart failure in dogs with degenerative valve disease. I will close with some thoughts about how one might incorporate ISEMID into clinical practice. As you are well aware, mitral valve disease is highly prevalent in adult small breed dogs, and when severe can lead to left-sided heart failure, activity intolerance, and respiratory signs such as cough, dyspnea, and tachypnea. The stages of mitral valve disease are classified according to the presence or absence of symptoms and the presence or absence of left heart enlargement, specifically left atrial and ventricular. Beginning with healthy dogs, stage A, the development of mitral valve disease in the form of a characteristic left-sided systolic murmur, but without any clinical symptoms of disease, moves dogs into class B1. As disease progresses and the mitral valve leak worsens, the left heart slowly enlarges and becomes volume overload. Dogs without clinical signs, but with evidence of radiographic or echocardiographic heart enlargement, moves dogs from class B1 into class B2. Finally, in dogs with more severe disease, left-sided congestive heart failure, typically in the form of pulmonary edema, can develop, and this moves dogs into class C. In dogs who now have pulmonary edema, initiation of diuretics is needed to clear edema. Other medications prescribed at the onset of heart failure include ACE inhibitors and spironolactone. And along with pimobendan, these four medications currently make up so-called standard treatment. In our discussion of ISEMID, the focus is on dogs in stage C, those with congestion and respiratory clinical signs. Specifically, the focus is on those dogs that for the first time in their history experience heart failure. That is, those with new onset congestion that have moved from the asymptomatic class B to the symptomatic class C. In practice, what do these dogs look like? A typical example would be a dog known to have a mitral murmur and evidence of left heart enlargement that has been taking pimobendan. This dog has been doing fine at home until the owner noticed an increased effort to breathe and an increased respiratory rate. Other common accompanying signs include decreased activity or appetite and a soft cough. On presentation, there might also be crackles ausculted in the lung fields. The resting respiratory rate is usually increased in dogs with congestive heart failure. Normal respiratory rate is typically less than 25 breaths per minute, while dogs with heart failure often demonstrate increased rates, typically greater than 40 breaths per minute. With regard to diagnostics, there is no better tool for diagnosing pulmonary edema than thoracic radiographs. In virtually all cases of heart failure, there should be substantial left heart enlargement. For those of you familiar with the vertebral heart size, or VHS method, the VHS in dogs with congestive heart failure from mitral valve disease is typically greater than 11.5 to 12. When visible, The pulmonary veins typically are larger than their corresponding artery. The distribution of pulmonary edema and resultant interstitial or alveolar pattern typically is perihilar and caudal dorsal. There are many excellent reviews regarding the VHS method and radiographic assessment of heart failure. Once congestive heart failure has been diagnosed, diuretic therapy is started, along with ACE inhibitors, spironolactone, and if not already receiving, pimobendan. Recently, the ACVIM Specialty of Cardiology published guidelines for the diagnosis and treatment of mitral valve disease, and these guidelines are available to the public on the journal's website. Until now, furosemide was the only practical choice of diuretics in dogs with first-onset heart failure. With the launch of ISEMID, veterinarians now have another diuretic option. We will spend the rest of the presentation discussing this particular diuretic called torasemide. ISEMID is an oral formulation of the loop diuretic torasemide, which is also spelled with an A and called torasemide. Torasemide acts in the ascending loop of Henle, where similar to furosemide, it blocks the sodium-potassium chloride cotransporter. The decreased reabsorption of sodium from the nephron lumen promotes natriusis and diuresis. As you know, loop diuretics, as a class of drugs, are considered potent diuretics due to the relatively large amount of sodium that is normally absorbed in the loop of Henle, and the limited ability of downstream nephron segments to compensate for this blockade. There are important similarities and differences between torasemide and furosemide with respect to their pharmacokinetic characteristics. This table summarizes some of the main pharmacokinetic properties of the two drugs. Let's start by looking at three important differences between torasemide and furosemide that involve the drug's bioavailability after oral dosing, its half-life, and its potency. Specifically, the oral bioavailability of torasemide is greater and more consistent as compared with furosemide, and is less affected by its relationship to administration with or without food. The plasma half-life of torasemide is approximately twice as long as furosemide. This, in relation to duration of effect, enables torasemide to be administered using less frequent dosing, that is, once a day as opposed to twice a day. With regards to potency of diuretic effect, when dosing on a milligram per kilogram basis, torasemide is 10 to 20 times more potent than furosemide. Both drugs exert a diuretic effect rapidly after oral ingestion. This slide shows the effect of these properties on the clinical usage of ISEMID. This is a graph showing equivalent volumes of urine produced over a 24-hour period when dogs are given either ISEMID or furosemide. You will note that once daily ISEMID causes the same amount of urine production as twice daily furosemide. The once daily dosing of ISEMID is one of its unique features, and how this might affect owner compliance in giving medications will be discussed later in this presentation. Examination of the data also indicates that on a milligram per kilogram basis, torasemide is between 10 to 20 times more potent than furosemide with respect to producing equivalent amounts of diuresis. At relatively low daily furosemide doses, between 1 to approximately 3 milligrams per kilogram a day, an equivalent amount of diuresis is produced when ISEMID is given at a tenth of the existing furosemide dose. At higher furosemide doses, doses at or above 5 milligrams per kilogram a day, an equivalent amount of diuresis is produced when ISEMID is given at a 16th to a 20th of the existing furosemide dose. This suggests that there is no one single conversion factor when converting a furosemide dose into a torasemide dose. The nonlinear potency of torasemide results in some important dosing considerations, as we will discuss in a few minutes. With that background in mind, let's next examine the results of the pivotal clinical trial that led to ISEMID's approval in the EU. This study was referred to as the Carpodiem study, or the canine relief of pulmonary edema by diuretic easy management. The Carpodiem study was a prospective multi-center study performed in 6 different countries or regions in the EU. The intent of the study was to demonstrate the clinical efficacy and safety of ISEMID in dogs experiencing their first episode of heart failure due to mitral valve disease. That is, the study specifically recruited dogs that had for the first time progressed from being asymptomatic to heart failure or stage C, and as such, required diuretic therapy for the first time. These dogs had what was referred to as first onset heart failure or pulmonary edema. The study randomly assigned dogs to receive either ISEMID or furosemide as their diuretic therapy. In order to decrease the chances of bias, both the dog owner and the attending veterinarian were blinded as to the drug assignment. In cases of emergency, this blinding could be removed and the identity of the diuretic known by the veterinarian. The results of this trial were published in the Journal of Veterinary Internal Medicine in the summer of 2020. The main efficacy endpoints were to show that the clinical effect of ISEMID over a 14 and 84-day period were non-inferior to furosemide. That is, treatment with ISEMID was no worse than treatment with furosemide. Primary proof of efficacy required a reduction of radiographic pulmonary edema and any existing cough, and no worsening of dyspnea or exercise intolerance as compared to baseline. This primary efficacy endpoint was examined on day 14 following the start of the diuretics. A second efficacy endpoint was defined as a reduction of existing cough and either reduction or no worsening of radiographic interstitial pattern, and no worsening of dyspnea or exercise intolerance. This secondary endpoint was evaluated on both day 14 and day 84. At first glance, these criteria might seem a bit confusing, but they are very important, so I want to spend a minute diving into them a bit more. As you know, common clinical signs of heart failure due to mitral valve disease involved increased respiratory effort, development of a cough, or exercise intolerance. But these signs are variably present in any individual dog. Moreover, the severity of any of these clinical signs can also vary. For instance, the degree of dyspnea might be severe and obvious to both owner and veterinarian, while in other cases, only a mild increase in respiratory effort might be noted. In such a case, the owner might have been alerted to a change in their dog's clinical status because of a new cough or reluctance to do activity. Thus, any efficacy endpoint has to be flexible enough to capture the wide range of signs and responses to medications that occurs. In conjunction with input by the EU's regulatory agency, the developed criteria represented the minimal expected or acceptable clinical response. That is, dogs could, and indeed most did, demonstrate improvement in most or all of these signs following diuretics. But at the very least, dogs receiving either diuretic must have had improvement in cough and no worsening of dyspnea or exercise intolerance in order to be considered effectively treated. These criteria allowed for dogs with relatively mild clinical signs to be evaluated using a system that was sensitive to either improvement or no substantial worsening of mild signs. Importantly, the primary efficacy criteria upon which the study hinged required a reduction in radiographic pulmonary edema. This requirement helped ensure that any improvement in clinical signs was linked to resolution of pulmonary edema. Finally, you will note that the secondary efficacy criteria maximizes sensitivity, in that it was acceptable for dogs with a mild pulmonary pattern, or what was assigned as score 1, to not completely resolve as long as the other clinical criteria were met. Again, this endpoint allowed for the fact that older dogs often have a mild interstitial pattern as a result of their age or concurrent respiratory disease, and some amount of interstitial pattern is always present, even after the resolution of heart failure. The use of these primary and secondary criteria was deemed as the most appropriate means to compare response to the two diuretic drugs and met the requirements of the EU regulatory agency. This slide shows the recruitment criteria. Dogs were eligible if their body weight was between 2.5 and 60 kilograms. They had to have a murmur consistent with mitral valve disease. Their left atrium to aortic root diameter ratio on echocardiogram had to be equal to or greater than 1.5. Their vertebral heart size on radiographs had to be greater than 10.5, and pulmonary edema had to be present. Clinical signs of heart failure included dyspnea, exercise intolerance, or cough. And dogs had to have no known renal disease, defined as BUN greater than 47 milligrams per deciliter, or a creatinine greater than 1.6 milligrams per deciliter. With respect to concurrent or previous therapy, dogs must have been either naive to any cardiac treatment or treated with an ACE inhibitor, pemobendin, and/or spironolactone at a stable dosage for at least 4 weeks prior to study entry. Dogs were not allowed to have received IV diuretics or have the need for hospitalization. No treatment with an oral diuretic was permitted except for oral furosemide at a dose not greater than or equal to 4 milligrams per kilogram a day for a maximum of 2 days prior to study entry. Digoxin, beta blockers, calcium channel blockers, and other vasodilators were prohibited. During the study, dogs were withdrawn from participating if their condition was such that they needed changes to their basic background therapy within the first 14 days, or they required diuretic doses above a pre-specified limit, meaning that control of congestion was no longer possible with what would be considered high doses of oral diuretics. We already alluded to the fact that dogs with first onset congestive heart failure due to mitral valve disease demonstrate variable degrees of clinical signs, ranging from mild to severe. Thus, the study allowed the veterinarian the flexibility to prescribe either a, quote, standard dose of diuretics or to temporarily administer a higher initial dose and then titrate back down to the standard dose as clinical signs improved. The different doses of ISEMID and furosemide are displayed on this slide. Depending on the severity of signs, dogs either received ISEMID once daily at 0.13 milligrams per kilogram a day with a permittable range of 0.13 to 0.25 milligrams per kilogram a day, or furosemide twice daily at 1.3 milligrams per kilogram a day with a permittable range from 1.3 to 2.5 milligrams per kilogram a day. You will note that at dose level 1, the standard dose, the dose of ISEMID is 1/10 the dose of furosemide, which reflects the previous findings that at relatively low furosemide doses, torsemide at 1/10 the dose of furosemide produced equivalent amounts of urine production. In dogs with more severe clinical signs, diuretic dosing of ISEMID was twice the lower dose, 0.26 milligrams per kilogram a day, with a maximum permissible dose of 0.5 milligrams per kilogram a day. Dosing of furosemide was 3.5 milligrams per kilogram a day, with a maximum permissible dose of 7.5 milligrams per kilogram a day. These higher doses could be given for up to 5 days, after which the dose was decreased to be within the lower dose range we previously mentioned. If dogs required treatment that was more sustained than this, or at doses higher than what is described, dogs were withdrawn from the study. At the higher dose level, or dose level 2, you will note that the equivalent amount of ISEMID is 1 to 13 or 1 to 14 the dose of furosemide, as opposed to 1 to 10, which reflects the nonlinear nature of torsemide's dose effect response as compared with furosemide. After enrolling in the study and being assigned to either ISEMID or furosemide, a recheck was performed 4 days later, and physical examination, serum chemistry, and thoracic radiographs were performed. This recheck helped ensure that the dogs were clinically improving and that no adverse effects associated with initiation of diuretic therapy was noted. 14 days after starting diuretics, dogs returned to the hospital to determine whether the treatment was effective according to the criteria we previously described. As a reminder, during the first 14 days, no changes to concomitant cardiac medications nor introduction of new cardiac medications was permitted. If the dog's condition necessitated either a change or new medication, the dog was withdrawn from the study. From day 14 onward, the goal was to determine whether or not the effect of ISEMID continued to be non-inferior to furosemide for up to 84 days, or approximately 3 months after the initial onset of congestive heart failure. During this time, one is interested in whether dogs will remain free of reoccurrence of congestive heart failure and avoid any adverse side effects. The 3-month follow-up period is important in that it represents about 1/3 of the median time that dogs with first onset heart failure are typically expected to survive. Previous studies have shown that the median survival time in dogs with heart failure due to mitral valve disease, that is, the time at which 50% of dogs will have died, is 9 months. Thus, the clinical response over the first 3 months of treatment represents a substantial proportion of time believed to be left for this population of dogs. In addition to evaluation of efficacy, the safety and tolerability of ISEMID as compared to furosemide was evaluated over the initial 14 days and then subsequent 84-day period, and this is the subject of the next slide. An important goal of the study was to evaluate the safety of ISEMID, and over the course of the study, dogs were monitored for any adverse events, or what the EU regulatory agency terms AEs. Under their definition, an AE is any unfavorable observation that occurs after study enrollment, regardless of whether or not the event is considered related to the study drug. For instance, a ruptured cruciate or flea bite dermatitis are recorded as AEs. Any unfavorable observation also includes any blood test whose value is outside the normal reference range, regardless of the clinical importance of such findings. Thus, a BUN or ALT result 1 unit higher than the reference range is recorded as an AE. Investigators are allowed to hypothesize which AEs might reasonably be due to the study drug and which are probably unrelated, but all AEs must be included in the overall number that occurred during the study. Finally, life-threatening or debilitating AEs are classified as serious AEs or SAEs, and their potential relationship to the study drug is also considered. The number and nature of AEs and SAEs helps determine the comparative safety and tolerance of the two study diuretics. There is one final endpoint to consider before we move on to the study results. As we previously mentioned, median survival time of dogs with congestive heart failure due to mitral valve disease is approximately 9 months. An important consideration involving different medications is their effect on this time. In the Carpodiem study, the time it took dogs to experience death or euthanasia due to cardiac causes, such as persistent or severe congestive heart failure or sudden death, or withdrawal from the study due to either need to introduce new medications other than the study diuretics in the initial 14-day treatment period, or need for doses above the allowable ranges for either torasemide or furosemide was examined. The rationale to accept either of these outcomes lies in the assumption that cases which fail to respond to conventional therapy typically have a grave prognosis. When we review results, it is important to remember that the effect of diuretic drug on time to cardiac death or treatment failure was not the main basis for this study, and these analyses were approved and conducted as a means to explore how the different characteristics of the two diuretic drugs might affect these important clinical variables. Finally, the study also asked owners to rate their dog's quality of life using a previously developed questionnaire specifically designed for this purpose, called FETCH. And now on to the results. The study took place between 2013 and 2015 and enrolled 321 dogs with first onset heart failure due to mitral valve disease from 6 different countries or regions within the EU. 2 dogs were found to have violated the enrollment criteria and were excluded, leaving 319 dogs that received at least 1 dose of the study diuretic. This population of 319 dogs, called the safety population, was used to assess the safety and tolerance of the study diuretics. Shortly after randomization to study drugs, an additional 4 dogs were found to have not fully met the inclusion criteria and were subsequently excluded, leaving 315 dogs. This population of 315 dogs, called the Full Analysis Set, or FAS, was used to assess the efficacy of the study diuretic. Examination of the study population shows a typical cohort of older small breed dogs. The average age was approximately 11 years, with slightly more males, 179, than females, 136. Average weight was between 8 and 9 kilograms. There were no significant differences with respect to severity of congestive heart failure, concurrent medications, quality of life, echocardiographic measurements, or blood values between dogs receiving ISEMID as compared with dogs receiving furosemide. This slide shows the results of the primary efficacy endpoint, treatment success including improvement in radiographic edema and cough, and at a minimum, no worsening of dyspnea or activity intolerance as evaluated 14 days after starting diuretic treatment. Treatment success was achieved in 74.4% of dogs receiving ISEMID and 73.5% of dogs receiving furosemide. Statistical analysis showed that this result met the pre-established criteria for non-inferiority, meaning that ISEMID was non-inferior, no worse, than furosemide in resolving clinical signs associated with the first onset of heart failure in dogs with mitral valve disease. As you might remember, veterinarians had the option of selecting 2 different doses of either diuretic, and in dogs initially receiving the lower dose, to change to the higher dose depending on the severity or persistence of congestive signs. In dogs initially receiving the lower dose of either torsemide or furosemide, the number of times that the veterinarian felt the need to increase the dose due to incomplete resolution of signs was higher in dogs receiving furosemide, 7.4% of time, as compared to dogs receiving torsemide, 1.3% of time. You will recall that a secondary measure of treatment efficacy was also evaluated at day 14 and again at day 84. At both time points, ISEMID fulfilled the pre-specified definition of non-inferiority. Specifically, the percentage of dogs meeting the definition of success at day 14 was 82.1% in dogs receiving ISEMID and 80.1% in dogs receiving furosemide. At day 84, success was achieved in 60.8% of dogs receiving ISEMID and 58.9% of dogs receiving furosemide. Fulfillment of both primary and secondary criteria at day 14 and secondary criteria 3 months after starting diuretics provides a high degree of confidence in the results. Thus, it was concluded that ISEMID can be used to resolve clinical signs associated with first onset of congestive heart failure due to mitral valve disease, with results that are no worse than results achieved with furosemide. This graph shows the radiographic pulmonary edema scores at baseline and days 4, 14, 42, and 84 of the study. The higher scores and more severe degrees of edema are shown as the darker shades of green and orange, and you will note that over the course of the study, scores improved, as evidenced by greater proportion of dogs in the lighter shades of green and yellow. These changes are consistent with resolution of edema once diuretic therapy starts. The change in these scores was similar between study drugs. This graph shows the fetch scores at baseline and at days 14, 42, and 84. Remember that the lower the fetch score, the higher the owner's perceived quality of life of their dog. There were similar improvements in quality of life between study drugs over the duration of the study. You will also recall that the study explored the time between initiation of study diuretic to either death or euthanasia due to cardiac causes or to treatment failure. Remember that treatment failure primarily involved the need for relatively high doses of diuretics or the need to introduce additional diuretics or medications. The Kaplan-Meier graph shown here displays the rate at which dogs receiving either study drug experience death or treatment failure. On the upper left of the graph at time 0, the start of the study, all dogs are alive and on allowable medications, hence the survival probability is 1. As time goes on, some dogs either die or experience treatment failure, and the proportion of dogs remaining in the study begins to decrease. As this happens, the curves slowly move down the y-axis. Analysis of these curves demonstrated that dogs receiving furosemide experienced either death or treatment failure at an earlier time than dogs receiving ISEMID, and that this difference was statistically significant. If you look at the table which shows the number of dogs either dying or experiencing treatment failure amongst treatments, you will see that the main difference lies within the group of dogs that required either high diuretic doses or additional medications. Thus, one inference from these data is that veterinarians needed to increase doses of diuretics in dogs receiving furosemide sooner than in dogs receiving ISEMID. This data agrees with the previous finding that more veterinarians increase the initial dose of diuretics in the first 14 days of treatment in dogs receiving furosemide, and that the need to increase furosemide dose persisted such that achievement of the highest allowable dose occurred sooner. This next slide helps quantify the findings of the Kaplan-Meier curve with respect to a dog's risk of experiencing death or treatment failure. These data are the results of what is called a frailty model analysis, which is an extension of Cox proportional hazards analysis, but has a better accounting of the heterogeneous nature of the study population and for any unrecognized variables that might influence results. The output identifies variables independently associated with time to cardiac death or treatment failure. In this study, these included the diuretic treatment, severity of dyspnea, NT-proBNP concentration, heart rate, and the echocardiographic size of the left atrium. The cutoff values used to separate the study population on the basis of each variable is shown in the second column. The remaining columns include the hazard ratio, HR, its 95% confidence interval, and p-value. How is this data interpreted? Let's use heart rate as an example. In looking at heart rate, after adjusting for the other 4 variables, dogs with heart rate greater than 150 beats per minute were 1.7 times more likely to experience death or treatment failure than dogs with heart rate less than or equal to 150 beats per minute. And this result was statistically significant. One can see that dogs with NT-proBNP assay greater than 900 were 3.85 times more likely to experience cardiac death or treatment failure versus those with assay results less than 900. Let's specifically look at how the study diuretic was associated with risk. You will note that the hazard ratio is less than 1. This indicates that dogs receiving ISEMID were at lower risk to experience cardiac death or treatment failure as compared to dogs receiving furosemide. The 0.36 value for the hazard ratio is interpreted as dogs receiving ISEMID had 0.36 times the risk as dogs receiving furosemide. Put in other terms, after adjusting for the other variables, there was a 64% reduction in risk of cardiac death or treatment failure in dogs receiving ISEMID versus dogs receiving furosemide. The 95% confidence interval of this reduction ranges from 35% to 81%. One should keep in mind that this result primarily was driven by the reduction of treatment failure, as we saw previously. In the next several slides, I want to show some additional results having to do with safety, tolerance, and owner compliance. Firstly, I'd like to show some results specific to safety and tolerance of ISEMID. As you remember that by definition, any unfavorable finding during the study is an adverse event. As a result, the number of AEs over the course of the study can be high. And during the Carpodiem study, 60.5% of the safety population, or 193 dogs, experienced at least one AE. Significantly more dogs receiving ISEMID experienced an AE as compared with dogs receiving furosemide, 109 dogs, or 67.7%, versus 84 dogs, or 53.2%. The majority of AEs, 84.3%, were classified as non-serious, the large majority of which were self-limiting and required no treatment. These included such things as a BUN value outside the normal range, but unaccompanied by any clinical signs. In the second table, you can see that the number of dogs experiencing a non-serious AE related to kidney or the urinary tract system was higher in dogs receiving ISEMID versus those receiving furosemide, 41.6% to 19.0%. AEs related to non-kidney systems, such as the GI or respiratory tract, were similar among groups. This finding likely speaks to the relative potency of torasemide as compared to furosemide. Remember that torasemide is between 10 to 14 times more potent than furosemide. Thus, the increased incidence of non-serious renal AEs might suggest a greater amount of diuresis and pre-renal azotemia. By and large, the investigators did not believe that these non-serious AEs indicated acute kidney injury or kidney failure, as they were self-limiting and did not trigger any specific treatments, such as cessation of diuretics. The next two slides examine the renal variables throughout the course of the study more closely. In the graph on the left, BUN is on the y-axis with a value of 50 millimoles per liter as the uppermost value. The upper reference range of approximately 10 millimoles per liter is shown by the dotted line. Along the x-axis are the various times at which the BUN was measured from day 0 to day 84. Dogs receiving ISEMID are in green, and dogs on furosemide are in brown. On the right is a similar graph, but with serum creatinine on the y-axis, the uppermost value being 700 micromoles per liter, and the upper reference range of approximately 125 micromoles per liter, shown by the dotted line. These graphs give you a sense of the typical values observed during the study. Again, consistent with the potency of torasemide, you can see that the BUN values in the ISEMID dogs tended to be higher than in the furosemide dogs. However, the large majority of BUN values did not exceed 15 to 20 millimoles per liter. A similar effect is noted in the creatinine results, with the large majority of values remaining below the reference limit in both groups. This slide shows the number of serious adverse events, or SAEs, within each group. There were more SAEs in dogs receiving ISEMID, 28 to 16, but this difference was not significant. In the second row, we can see that there was no difference in the number of dogs either dying or being euthanized due to SAEs between the groups. As death or euthanasia is the most serious of adverse events, let's look at these more closely. With regard to the 12 dogs receiving ISEMID that either died or were euthanized, 10 of 12 were due to known or presumed cardiac causes, involving such clinical signs as sudden death or acute respiratory distress. The remaining 2 dogs receiving ISEMID died from non-cardiac causes, including 1 for sudden onset of ataxia and 1 for pyometra. With regard to the 11 dogs receiving furosemide that either died or were euthanized, all 11 were done so for known or presumed cardiac causes. Once again, the number of dogs dying among the 2 different diuretic groups was not different. This slide shows data regarding owner compliance in dosing either ISEMID SID or furosemide BID during the initial 14-day treatment period. This was done by counting the number of tablets remaining at the 14-day recheck. While compliance related to either diuretic is high, compliance was significantly higher in the SID ISEMID group as compared to the BID furosemide group. ISEMID is formulated as a flavored tablet, and 80% of dogs in the ISEMID group voluntarily ate the tablet either alone or with food without the owner having to force the medication into the dog's mouth. A little more than a quarter of dogs ate the ISEMID tablet without any food, as compared to only 8% of dogs receiving furosemide. There are many other aspects of the Carpodiem study that you might be interested in, and we refer you to the scientific report published in July of 2020 in the Journal of Veterinary Internal Medicine. Online access to the journal is free. In conclusion, I'd like to highlight the following points. The Carpodiem study sought to evaluate the efficacy and safety of ISEMID in dogs with first-onset heart failure, specifically in the form of pulmonary edema due to degenerative mitral valve disease. It fulfilled its primary and secondary objectives in showing that treatment with ISEMID was non-inferior, no worse, than furosemide after 14 and 84 days of therapy. Dogs receiving ISEMID experienced a 64% reduction in the risk of death or euthanasia due to cardiac causes, or the need for high doses of diuretics or additional cardiac medications. This finding was mainly driven by the latter outcome. Dogs receiving ISEMID were less likely to require dosage increases during the first 14 days of treatment as compared to furosemide. Non-serious adverse events, such as subclinical increases in BUN and creatinine, were common in both groups, but more so in dogs receiving ISEMID. The number of dogs experiencing serious adverse events was numerically higher in the ISEMID group, but not statistically different among groups. A similar number of dogs in either group died from either cardiac or non-cardiac causes. No dog in either group died of kidney complications. Overall owner compliance during the first 14 days of diuretic therapy was high, but significantly greater in dogs receiving SID ISEMID. This slide summarizes the current recommendations for the use of ISEMID in treating first-onset heart failure in dogs with mitral valve disease. Depending on the severity of signs, 2 different dose levels are available. If the higher dose is used, attempts to titrate back down into the lower dose range is recommended. The high dose should not be used for more than 5 consecutive days. As with all diuretics, monitoring of hydration status, water consumption, urination, as well as blood testing of BUN, creatinine, and electrolytes is recommended. These dosing recommendations are included in the package insert. Torasemida is provided as 1, 2, and 4 mg flavored tablets suitable for SID dosing. I hope this presentation was useful and informative. For those of you attending the webinar on November 13th, 2020, I will be available for questions. Thank you to all the dog owners and veterinarians that participated in this study.